we are as a country in terms of the status of healthcare in Kenya, even in the midst of a pandemic. So want to expound that particular discussion, the status of Kenya when it comes to healthcare, even as we battle the coronavirus pandemic. Looking at the numbers, the vaccination drive is still ongoing. And just recently, there was a health conference. Well-articulated issues were actually aired during this particular conference, and we want to get into the thick of it, even as we expound on this particular discussion. I'm joined in studio by Diana Gishengo, who's the manager of health rights at Amnesty International. There were key stakeholders in terms of that particular conference that was held just recently. So it's great to have you with us. Good morning.
Good morning.
Okay, I'd like us to start with perhaps looking back and evaluating how far we've come as a country, looking at the vaccination numbers, looking at the number of vaccines that are in the country. Well, what's your take in terms of the vaccination effort by the government and the nitty-gritty issues when it comes to vaccine inequity?
Okay, fantastic. And you start on the right note, because I'm actually the head of campaigns manager inequalities. Okay.
Yeah.
And so the focus on health is because as Amnesty, we have identified health and the response to COVID as one of the areas where we are seeing lots of inequalities and iniquity. So currently, there are close to 5 million vaccines in the country. We've received donations from every part of the continent. And I think we have purchased one batch of vaccines. But considering where we started, and I'd like to take you back, when the government first made the first report that Kenya would finally get into vaccination under the global program, we had an ambitious plan where we hoped to have vaccinated 30% of the adult population by 2024. They have since revised that, and as Amnesty, we really pushed that the Kenyan government needs to set aside funds to ensure that every single adult in Kenya is fully vaccinated within a year. Why was this push necessary? It's because we have realized we have a major problem, and the Chief Administrative Secretary, Ministry of Health, raised that one of the things that really ails us is the lack of self-reliance when it comes to matters health. So we rely on donation for a very, very, very vital function of the entire population. Primary health affects everybody. So we were glad that at least the last budget had some 6 billion in there, and later more money for distribution of COVID-19 vaccine. Then immediately after the budget reading, the president committed that they would vaccinate the entire population by next year, December. Something that is commendable, but not good enough. Why? Because from the feature that you have just aired, we are now moving into a universe of the vaccinated versus the unvaccinated. Currently, in Kenya, only 3% of the adult population is fully vaccinated. 3%. At a time when we are staring at elections, the campaigns, the crowds. Before we got into the campaign period proper, we have seen crowds of people trying to move mountains, oceans, and so on. And unfortunately, what COVID has taught us is we are not one bit prepared in terms of our public healthcare system or even the private healthcare system. Because anytime we have surges, frontline workers, hospital, all of them decry that they are overwhelmed. The number of people who finally get to hospital for COVID-19 complications are very few. So it is really unequitable to see politicians pulling crowds and not to discuss how to protect the population. In my opinion, the political class, even out of their own selfish interest, should be advocating vehemently for vaccination of everybody before they can start mobilizing crowds. And think about a number of national processes where we have now realized our government has the capacity to get to the lowest level, mobilize people. Sure. I'll just take two processes. Huduma number. Look at the amount of public information that was put out, all civil servants speaking about a national government process and program. All governors joined in mobilizing everybody, even with the resistance because of certain issues that didn't seem right, they got to the ground. Why are we not seeing that level of mobilization when it comes to vaccines? The excuse has been, previously we had very, very limited doses of vaccine. Therefore, they prioritized the frontline workers. Yeah. Now we have done fairly well with the frontline workers, security officials who are also frontline in their own way. The elderly, we are not yet quite there. Okay. And save for a few counties that have attempted, we've not seen a drive to try and protect our elderly, and now it's being opened some more. If you look at the statistics of vaccination in Kenya, it is very, very urban-centered. Nairobi is at 10%, okay? When counties like Turkana, Marsabit are barely at 1%. So even as we discuss global apartheid or around vaccine, we also have our own Kenyan vaccine inequity that is very, very rural-based, okay? Yeah. And all the counties that have previously been marginalized are still marginalized up to now. And these are also the counties that are really, really struggling with the public health infrastructure. It's always very sad to note that within Nairobi and Kiambu, there are about 5 or 6 referral hospitals, okay? If you divide, say, from Marsabit all the way to Mombasa into half, that half has not a single referral hospital. So that is where we are. And then right now, we had expected very high uptake. The people who have information, those of us who have read on social media, we have our own information, we know vaccines protect us. We were the first ones to jump the queue, okay? Yeah. The people who have no information, they are not anti-vaxxers. They're just hesitant because they don't know what animal is this. All right. Okay? So why the investment in information is also lacking in a big way.
But would you say there's goodwill from the government? Because looking at some of the goals we've set for us as a country in terms of achieving that required number in terms of inoculation, you mentioned the goal has been coming down ever since 2024. So in an ideal scenario, and this being a political year, how best should we push this narrative in terms of vaccines so we reach a desired number of the adult population who are vaccinated even before the election and the campaigns start? Because there's usually a narrative, those on the political podiums are the ones who are inoculated, but the masses down there are barely vaccinated, you know?
So I think, one, we need to have a very a broad plan that begins with a lot of public information, okay? So, and Kenya has very good structures of disseminating information. We know who listens to who, and in the beginning, religious leaders, the political class did try to ensure that this information was on the ground. Secondly, we need a plan per county.
Okay.
That targets first the most vulnerable in terms of age and people with pre-existing conditions that make them more vulnerable. We ensure we reach those by October, end of October. And in the initial plan, it was a very good and ambitious plan. We were supposed to be vaccinating 400,000 people per day. So if we can roll out that particular plan and split the 400,000 into the 47 counties, we would have come closer per day. If we did that per day, calculate each county to each month, October, November, December, to have even 20 working days. Okay? It therefore means we are doing, is that 8 million?
Yeah, roughly.
8 million. 8 million in October, 8 million in November, and 8 million in December.
So it's achievable, yes?
It's very achievable. We will register 7 million voters in 3 months. Okay? So we can surely do the 16 million. If by December we have gotten to half of the adult population, the likelihood that we have covered the most vulnerable is very high. Then between January and March, before we get to the peak of the campaign periods, we have covered everybody else. But at the heart of it is proper and equitable distribution channels and information reach for everybody. However, where are the vaccines? If the available vaccines in the country are 5 million, we cannot surely plan to distribute 8 million when now we have a lower number. So the government needs to urgently put in place measures to procure vaccine. They are global optics, okay? But if we keep relying on leftovers from the global north, then we are going to remain behind. If we are to begin investing in self-reliance, we start by purchasing, okay? And as that happens, because this is a very hard lesson, can we already invest in knowledge, research, and facilities to produce our own vaccines? Look at Cuba. It is not a very developed country, but they have their own vaccine, and whereas they belong to the global south, they are already vaccinating all their entire population. Surely, Kenyans are brilliant people. We have the necessary resources, but like you have rightly put it, we are not yet in the right place in terms of political goodwill to become that self-reliant in matters health, in matters vaccination.
Okay, I have to ask, is it just down to goodwill? Because, I mean, at the end of the day, the resources factor is quite important. Are we looking at a scenario where we need perhaps a supplementary budget to sort of buffer up the sort of funds that are set aside for the vaccination drive in the country? Where are we?
So, one, it's the political will. And the minute the people who control our budgets realize that vaccinating the entire population is an urgent priority, then that's why we are calling urgently for a supplementary budget, because the budget amounts that were allocated in the budget that was read in June are very low, okay? So ultimately, we urgently need a supplementary budget to enable the government to be able to purchase the needed vaccine. And which is unfortunate, because if you look since the first case of COVID, we have gotten very, very many loans and grants in the name of COVID, okay? And we are yet to get a report that this is how much we have developed the health infrastructure, this is how much we have prioritized COVID recovery. And part of COVID recovery is vaccination. Okay? So there's something that does not quite add up. And therefore, because Kenyans and everyone is saying we are only as wealthy, we are only as secure as our health. If other Kenyans have realized that, our representatives need to be adequately informed to do the right thing and urgently pass a supplementary budget for COVID-19 vaccines and distribution.
Okay, so perhaps a more concerted approach in terms of goodwill, in terms of resources flow, because other people were even comparing this particular vaccination drive with those that were held earlier. In terms of the polio one, the flow of information was quite clear. So I get where you're coming from. But apart from Kenya's vaccination drive, where would you say the state of healthcare is as a country currently? Because we well know at times functions follow resources. So when it comes to the resources aspect and the Treasury allocating a percentage of the national budget to healthcare, have we achieved that desired effect in order to enable the healthcare systems in the country to do their functions?
A very good question. So first is, as a country, and a country that is devolved, the cumulative budget for health should be a minimum of 15% of the entire budget. This is something that is not passed by the United Nations. This is an African principle, part of the Abuja Declaration and Guidelines on the Right to Health, 15%. To ensure, to get us to the right place. So that's the very minimum. Now, health is largely devolved. I would say 90%, 80%, because only research and referral hospitals are supposed to be retained by the national level. Even human resource has been devolved to the county government. But over the last 5 years, we have been on an average of 5.8% of the national budget as the allocation for health. And even within that particular percentage, the bulk of the resources come from grants and donations from other bodies. During COVID, we have seen a slight increment, and this year, if you look at the national budget and the supplementary budget, we are moving towards 8%. So still very far away from the Abuja Declaration. The second challenge, and which was raised very well by the chair of the Health Committee within the Council of Governors, Professor Anyang' Nyong'o, is how do the funds trickle down to the counties? So counties are supposed to have not less than 30% of their county budget going to the health function. But we've seen delays and a lack of accountability in the division of revenue between the national government and the county. County funds are always delayed, okay? So I have learned, sadly, that every single month in this country, at least 5 counties, health workers are on strike. Why? They have no salaries and so on. So in terms of resourcing the health function, it's a really dire situation because of, like this year, of the 8%, only about 2% has gone to the counties where the work is. Procurement of medical supplies and equipment has been retained at the national level, and we have seen lots of challenges in the distribution within KEMSA, meds, and so on. And things that have raised, they have affected treatment of TB, HIV/AIDS, pediatric HIV/AIDS patients are still suffering. So there's a very, very big problem. But let me also acknowledge that COVID has also helped, to a great extent, improvement of infrastructure at the county level.
All right.
Each county can now take pride in increased bed space. A number of counties built ICU facilities for the very first time, okay? And this was done within the supplementary budget of them responding to the second wave and third wave of COVID.
Okay.
We still have some struggles, and then during this period, a number of counties have, for the first time, installed oxygen plants that are necessary not just for COVID, but management of most respiratory diseases, people who suffer acute injuries during accidents, and so on.
All right.
So it's a struggle, but we have made some progress. It doesn't feel like the lessons have impacted us in a strong way as they ought to. Okay. But there's some progress.
So there's significant progress. And I'm sure even as you're talking about resourcing health functions in the country, the pilferage, the wastage of resources is also a key issue, especially in the health docket. As we've seen how it developed in KEMSA, that's at the national level. At the county level, it's well known that perhaps we just didn't devolve functions. We might have devolved corruption from the national government as well. So in terms of making sure the money goes to the intended recipients, was there any outcome in this particular national conference on how we will enable these independent agencies to do their part and tighten the noose?
Corruption within our public and private spaces is something that has become so deep-rooted that sometimes you're not sure what to do. But during this health conference, first, it was a presentation of how much we have lost within COVID. That was just appalling. And the fact that even when people are suffering, they are dying, everybody is in a WhatsApp group trying to fundraise for bills and funerals, somebody still deemed it fit to steal from public coffers. Now, within the health conference and looking at all the institutions that have somehow been slow, if not reluctant, in investigating these people and trying to tighten the pilferage, the conference felt that ultimately we need the people to come on board and define how they want health sector, the resources therein, how to curb corruption by creating something that we now call the Afya Nation movement. What does that mean? It means we will want to create people, pressure groups across all spaces. From sub-county to county, that are every day auditing in their own small ways. It means we'll have to understand the budget, the existing resources around health, infrastructure-wise, supplies, and so on. Audit the number of health workers that we have, and then define for ourselves what it would take for us to have a truly health nation that is adequately resourced. So whereas we are still calling on EACC, the ODPP to do their investigations, it has also come to the point that there must be stronger and concerted public actions to demand accountability and ultimately set the priorities and solutions that we want for ourselves.
I mean, we're a reflection of our leaders at the end of the day. So that movement perhaps is a step in the right direction in terms of agitating for the needs, because it all boils down to who we choose to represent us. And speaking of representation, there's a couple of developments happening in the National Health Insurance Fund Act, a couple of amendments still in Parliament, but all this has to do with universal health care and the access of health regardless of one's social or economic status. So looking at the NHIF and how it should cater to our problems, it's not ideal yet, but what's your take on it, even as deliberations are set to ongo in Parliament? Even today, I'm sure they're set to debate on that particular NHIF Act.
Thank you, NHIF. And as Amnesty, we have always advocated that as many people are enrolled onto NHIF as possible to ensure that families are buffered and everybody is able to access universal healthcare. But if we look realistically at NHIF, I think this year there's a report that shows that they are suffering. They are suffering from liquidity issues. I don't want to say NHIF is broke, but they're suffering from liquidity issues. This is the National Health. It's now no longer hospital, health insurance fund. And the proposal is that all households contribute and then they will get universal health care. The 4 counties that rolled out universal health care did not apply this model. They did not apply the NHIF model.
All right.
Machakos used there was a different enrollment that allowed everybody to come and register one time. They have been encouraged to get onto NHIF, but it was not the ultimate determinant. It was that the county would prioritize universal health care using the taxes that they have received from the people.
All right.
Okay?
Yeah.
And just to discuss this further, the amendments are a good thing, and it's important. It's very clear that we have to contribute to all the socioeconomic services. We pay a fee for water. We contribute to education, even if it's subsidized in public facilities. So we must contribute to health, and that contribution looks like NHIF. But there's not, that must be accompanied by an equal push of tax allocation. Because if you want to test it, think about the COVID period and the announcement that NHIF will not cover anything COVID related, whether you're admitted, whether you're going for a test. This is the National Health Insurance Fund, a fund that is not only supposed to be insurance-based, it is supposed to be to have aspects of socialism in it. Okay? That can only be supported by a very, very strong resource base from the tax allocation. So it feels defeatist in that sense, and it comes at the worst moment because most people who then were affected and were paying their regular NHIF contributions and could not benefit from it during